Hi, this is Courtney Kinder, registered dietitian and clinical educator for Vibrant America. Today I'm going to do a walkthrough review of the Vibrant Peanut Zoomer. Okay, let's start with some peanut facts. Peanut allergies affect around 1.2% of the overall U.S. population, and it's the most common food allergy among children. Peanut allergies have tripled in the past 20 years. Approximately 1.2 million, or just over 2% of children and teens, have been diagnosed with a peanut allergy. Rates are growing faster in westernized countries. Peanut allergy is a very real problem with a potentially fatal reaction of anaphylaxis. Epinephrine, or adrenaline, is the only available treatment for a severe peanut allergy reaction. Early diagnosis of peanut allergy or sensitivity can greatly increase the quality of life and reduce the risk of developing future disease. Peanut sensitivity and allergy can also increase food-related anxiety. Early detection of peanut allergy or sensitivity will help to identify a proper individualized management plan and enable confidence in dietary and social activities. Peanuts are one of the most widely used nut sources in processed foods, mostly in the US and European countries due to their high quality protein and oil content. Unfortunately, it is also highly difficult to follow peanut-free diets because most processed foods contain peanuts as protein extenders. The Vibrant Peanut Zoomer is an array of peanut antigens which offers very specific antibody to antigen recognition. The antibody levels to the individual proteins are calculated by comparing the average intensity of the individual protein antibody to that of a healthy reference population. You can see the validation report in your provider portal for more details. Vibrant uses proprietary fluorescent analysis, which is designed to assay specific total IgG, including subclasses 1, 2, 3, and 4, and total IgA, including subclasses 1 and 2 antibodies. Peptide level antibody testing essentially zooms in past the whole protein and is looking at the reactivity to thousands of different peptides inside of the whole protein of peanut. The peptide-based microarray technique eliminates the requirement of testing different forms of foods, like raw versus cooked, and removes the false positives caused by cross-reactivity often seen in raw extracts. Fasting is not required for the food zoomers, and there are no dietary supplement restrictions before testing. Vibrant does not recommend a food challenge if you are already aware that you have an adverse symptom to a food. However, if the food has been removed for a significant amount of time, then it may affect the accuracy of the results. If your patient is taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medications, you may not get an accurate result of their antibody levels. We recommend testing 14 to 30 days after discontinuing these medications, or testing total immunoglobulins before testing specific antibody levels to foods. So who needs a peanut zoomer? In addition to ruling out a peanut allergy, which is an IgE reaction, we're also looking for peanut sensitivity on the peanut zoomer. Some common conditions and symptoms associated with peanut sensitivities include things like IBS-type symptoms like gas, bloating, stomach pain or cramping, constipation, or diarrhea. Autism, because peanut sensitivity can worsen irritability, hyperactivity, and repetitive behaviors in children with autism. Presence of other food sensitivities and allergies. Family history of sensitivities or allergies to peanuts, eczema or dermatitis or an undiagnosed skin condition, and it's not mentioned here, but individuals with asthma are also at higher risk of peanut sensitivity. Clinical connections and facts about peanut sensitivity. While peanut allergy is well understood, peanut sensitivity is not as well studied. Some current theories suggest that early sensitization to peptides in peanuts may lead to greater risk for allergic response. The Vibrant Peanut Zoomer can aid in assessing clinical risk and need for the dietary adjustment for individuals that have a higher risk for peanut sensitivity and provides further insight into peanut sensitivity. So on the peanut zoomer, we're evaluating both IgG and IgA immunoglobulins to a wide spectrum of peanut peptides, which are major causes of peanut sensitivity. Early detection of peanut sensitivity can reduce the risk of developing into an allergy and identifying a proper individualized dietary management plan. Vibrance Peanut Zoomer includes the most recently identified peptides in the peanut proteome, which we're going to review. So what does the peanut zoomer include? So the peanut zoomer includes the following antibodies, testing for both IgG and IgA. On the left are the peanut protein families. In the middle is their individual antigens we're testing on the panel. And on the far right is a column with a brief description of its nature. We'll go over more aspects of the antigens on the next slide. Here are the families of proteins in the blue ring around the peanut graphic, and branching out from those are the individual peptide groupings. The designation ERA-H comes from Ericus hypogea, which is the genus and species of peanut plants. Ericus is the genus name of a flowering pea family originally coming from Brazil. Species name hypogea means under the earth. The most abundant peanut protein is known as ERA-H1 and contributes 12 to 16% of the total protein content of a peanut. Diving deeper into the peanut antigens and their properties. Here we can see if it's a major antigen, which is 1 through 6, or a minor antigen, which is 7 through 12, in its association to peanut sensitivity or allergy. We can also see if there's cross-reactivity or high homology with another food antigen. The most significant for allergy detection are the proteins called RH1, 2, 3, 6, 8, and 9. The protein RH9, like RH1 through 3, can trigger severe peanut reactions. However, most RH9 allergy is limited to just Southern Europe. Those with an RH9 sensitivity may also react to fruits containing pits, such as cherries or peaches. RH1, 2, and 3 are heat-resistant storage proteins frequently involved in severe peanut reactions. Up to 95% of those who test positive for RH1, 2, or 3 experience allergic symptoms after eating peanuts, including anaphylaxis. Of these 3 proteins, ERA-H2 is the most frequent predictor of peanut allergy and is more often associated with severe symptoms. ERA-H6 is structurally similar to ERA-H2, and together they account for a large portion of the peanut allergy symptoms in the U.S. Heat-alterable ERA-H8 proteins are correlated with cross-reactivity to birch pollen and typically trigger only mild localized reactions to peanuts. Just a small percentage of those who are RAH positive report problems after peanut ingestion. Important to note also that antigenicity is increased in roasted peanuts versus boiled or raw. Here's the Peanut Zoomer summary page. The score is calculated from the patient's IgE, IgA, and IgG reactivity to their respective antigens, with a higher weightage for IgE than IgA and IgG. Weightage is also assigned to the antigens based on its importance and abundance in the specific food that is tested. Below that is the IgE, known as the classical food allergy or type 1 hypersensitivity, to peanut, which is luckily negative for this client. Below IgE is the summary report of what peptides had positive, or what we would think of as high, antibody levels in the light blue on the left, the moderate antibody levels in the darker blue in the middle, and the negative antibodies in green on the right. So here's a little bit about IgG and IgA. So IgG immunoglobulins are in all tissues of our body, and it has a longer half-life of about 3 to 6 months, which is how long it would take to leave the body after exposure to the food is stopped completely. IgA is in our mucosal immune system, and its half-life is much shorter, around 2 to 3 weeks. It's important to note that if the patient is still consuming even just small amounts of peanut here and there, they may continue to make antibodies to peanut despite cutting way down on their consumption. Let's review this panel. So under the positive section, there is a high amount of antibodies to prolamine, RH2, and RH7. I would strongly suggest no peanuts at all for this patient since the RH2 is the most often associated with severe symptoms. A moderate amount of antibodies to peptides of cupin, prolamine, profilin, BET-V1, oleosin, and defensin. And since they have antibodies to RH3, they also need to avoid soy and tree nuts, or we could run a soy or a nut zoomer to know for sure. Since they have antibodies to RH5 and 8, they also need to avoid birch pollen. Since they have antibodies to RH9, they also need to avoid sesame and hazelnut. It's important to note that even if the patient has only one peptide to peanuts positive or moderate, they are still considered peanut sensitive, just to a different degree. At Vibrant, we also offer an add-on panel that tests IgG4 and C3d to further assess if the patient's sensitivity is more likely to be mild versus severe, or to assess whether to do a future physician-supervised in-office oral peanut challenge. This image is from the Peanut Free Guide, which you can find in your provider portal under the educational section on the left-hand side of the home page. Here we can see peanut-containing foods, such as the obvious ones like peanut butter, but also things like peanut flour, peanut meal. We can also see foods that may contain peanuts, such as cereals and certain types of granolas. Other names for peanuts, such as Arachis oil, ground nuts, and non-food sources of peanuts. So that could be in things like craft materials or lip glosses. Here are some lifestyle considerations. So if the patient is highly sensitive to peanuts, we're going to want them to avoid all peanuts. The primary and important standard of care management to avoid peanut-related incidents is to strictly adhere to a peanut-free diet. This also helps to reduce stress on the immune system and reduce the risk of developing sensitivities to new foods. We also want to always read the advisory labels before consumption. In the US and most other countries, it is a legal requirement that the product labels of prepackaged foods should clearly and accurately provide information on allergenic foods such as peanuts. There are two main places on the label to find this necessary information. The first is the ingredient list, which should highlight peanuts, almonds, hazelnuts, walnuts, cashew, pistachio, Brazil, pecan, macadamia, or Queensland nut. The second is the precautionary label containing either may contain or not suitable for statements. The second label is not mandatory to highlight, however. So peanut-sensitive individuals are always advised to check the ingredient label before consumption. Moreover, the law clearly states that restaurants and cafes are required to provide their customers with clear information about nuts in non-packaged foods. It's your practitioner's discretion to allow your patient with just a moderate sensitivity to peanuts to do a rotation diet. A rotation diet often will include mild to low sensitive foods once every 4 days. You'll also want to educate yourself about cross-reactive foods. It is advisable for individuals with peanut sensitivities to avoid all tree nuts typically. Studies have shown that a significant number of patients with peanut sensitivity and allergy will also develop sensitivity to one or more tree nuts. Hence, the best practice is to completely avoid all types of tree nuts. You also can boil or fry peanuts without roasting them to help decrease the antigenicity. Consider airway and skin exposure routes as well. Cutaneous exposure through impaired skin barrier or inhaled exposure. Given the clinical significance of peanut allergy, we recommend following the guidelines of the National Institute of Allergy and Infectious Diseases for peanut allergy diagnosis and the management of your peanut allergy patients. I've included their website at the bottom of this slide where they have downloadable resources for providers as well as for patients and caregivers that are really helpful and what we often recommend on the clinical team. And lastly, here are the Peanut Zoomer resources that are available to you on the educational section of the provider portal. Thanks so much for listening to this Peanut Zoomer walkthrough video. If you have additional questions, please schedule a clinical consult on your Vibrant portal with one of our clinical educators to help you review your client's Peanut Zoomer results.